Okay, everybody, welcome back. We are in the middle of the heart of my sessions with you. The heart of it meaning we're really giving you the tools to make up your mind about whether psychiatry is really practicing medicine or whether it's doing something that is a kind of counterfeit medicine. And you know that it is my point of view. Everything I've seen in nearly half century of being a psychiatrist, that is exactly what psychiatry is doing. And they're doing it because the psychiatric profession was threatened starting in the 1970s, even the 60s, with the threat that they could be supplanted as the leaders of the mental health professions. Last time I talked about that. And I talked about many things about what medicine is and what psychiatry is. How psychiatrists don't really diagnose anybody. Therefore, they're not really treating specific disorders, even though they claim that they are. This time, I want to then talk more about what is psychiatry. I've been talking about what it isn't. It isn't really medicine. Of course, psychiatrists are medical doctors, just like I am. They are allowed to give medications and other physical intrusions on the body because they're medical doctors. They are in charge of hospitalized and institutionalized patients. But when I say they're not practicing medicine, what I mean is they're not diagnosing disorders. They're trying, but they haven't found any. And the things that they do to people are not genuine treatments, not in a medical sense. And I want to explain more of that. So if psychiatrists are not diagnosing people, what is that? How can I say that when Mr. Smith is said to be a manic depressive? And Mrs. Jones is said to be been diagnosed as schizophrenic, etc. Those are labels or summaries of how somebody is doing, how they appear to others, what their distress is like. And as I've said many times, nothing that I am saying should be taken to minimize the reality of those problems. Psychiatry did not invent the problems. People have these problems, and they're very, very difficult, very hard on the people around somebody because they're so hard on the people who are experiencing them. This is not a series about claiming that mental problems are somehow a sick society, as some people maybe have claimed in the past. That's not Dr. Lee Coleman's point of view. The problems are real, but psychiatry is inventing pseudo-solutions in order to rescue itself. So what psychiatrists do is summarize the symptoms and the presentation of the person and call that a diagnosis. They do that primarily by the publication of a book. I happen to have an older edition of what that book is. The first edition came out, I think maybe in the 50s. But until 1980, it was a rather thin volume and made no pretense that they were diagnosing medical diseases. Basically, it was describing the symptom patterns of the patients. Psychiatry decided in the 70s that if they were going to prevent their displacement as the leaders in mental health, they needed to be more medical. As I used to hear them say in medical school and residency, we need to put our stethoscopes back in our pockets, on our lab coats. Psychiatry felt that they had to do something to be more medical, and the way to do that was to do a better job of diagnosing people. Now, when they created this diagnostic manual, the 3rd edition that came out in 1980, they frankly admitted that they could not arrange these so-called diagnoses according to the causation of the patient's problem, because there was so much disagreement about what was the cause, they could never do it. So they decided that they would set up a system of labels in which they would try to make the psychiatrists better at agreeing with each other. Now, again, this is the part where I want you to be thinking and make up your mind. Don't take my word for anything. But is it sufficient to set up a system by which a number of people agree on something? Is that a good way to decide on whether you have found something truthful? Is science a democracy? Is science something that you arrive at with consensus? Get a bunch of people to agree on something, and therefore you know you're closer to the truth? I don't need to tell you that that doesn't work. Look at any kind of historical development, any kind of social development. Look at the world as it sits right now, and you surely will understand that getting a lot of people to think the same thing doesn't tell you whether you're getting closer to the truth. And that's what science is all about. It is a way, by having a collection of information which is verifiable. That is, you have to have a way to test whether an idea is working or not. Because psychiatrists admitted, when they came out with this new 3rd edition of the Diagnostic Manual in 1980, that there was no agreement on what the causes were, then they could not possibly, by consensus or taking a vote, have advanced in finding the diagnoses. And with each successive edition of this diagnostic manual, the problem has gotten worse and worse. The manual gets thicker and thicker, more and more categories. And what does that do? It takes us closer and closer to the phenomenon that more and more people will be labeled as having a mental disorder by having a diagnosis. We now have vastly more people who are claimed to have been diagnosed, and they have not been diagnosed. They've simply had summaries of their symptoms. Now, so therefore, what psychiatry calls diagnosis is not diagnosis. Next, if you do something to somebody with the claim that you are treating a bodily dysfunction, when in fact you haven't found any bodily dysfunction, what do you think are the chances that what you do to their body is actually going to address something that is wrong in their body? We haven't found anything wrong in the bodies of people with mental disorders. Psychiatry admits that. They continue to create these labels, these summaries of what is the distress is like, and call it more and more brain diseases. But since they haven't found any brain diseases, the chemicals and the electroshock they use cannot be addressing directly what is wrong, because they don't know what's wrong. They don't know there is anything wrong. There is no reason to assume there's anything wrong with the brains of people who have mental problems. That doesn't mean that mental phenomenon are not taking place in the brain. Of course, mental phenomenon is taking place in the brain. But we have never identified any disorder. We can no more say that the brain is malfunctioning when a person has a mental problem, then we could say that the brain of Johann Sebastian Bach was malfunctioning when he composed his brilliant music. It was so much outside the mainstream, or Beethoven, or any other fantastic accomplishment that we could think of. So, because we've never found any brain dysfunction which resides in the brains of people who have the things that are being treated by psychiatrists with drugs and shock, that means that what we're doing to them is not truly treatment. Let me tell you what it is. It is creating a new problem. It is creating a disorder which is designed to compete with the original problem. The original problem doesn't have a known biological cause, but certainly when you give a drug, you are creating a biochemical problem in the brain. The drugs work by creating a dysfunction, a disorder in the brain. All of them do. The drugs that psychiatrists use for the most part are all tranquilizers, and they have a tranquilizing effect. Depending on how you conceptualize your thinking, you can define that change as an improvement. Just like Benjamin Rush said that when people were suddenly easier to handle because he took enough blood out of them, and said it because they must have had too much blood in the beginning, if you give somebody a tranquilizing drug and they then are easier to manage, that is not a treatment, that is creating a disorder. And by the way, I'm not even saying that that is always a bad thing to do, but only if it's done with the patient's consent. We're going to talk about that in a different session, but psychiatrists don't treat brain diseases because they haven't found any brain diseases. Therefore, what they do is not treating anything. It is creating a new disorder. So, for example, and the use of language, let's move on to that. If a drug, which is in essence a tranquilizer, is given to a person who is out of touch with reality, and I've said that's a real problem, it is a real thing, and the drug is a tranquilizer, then there is no evidence that that drug is an antipsychotic. That is a linguistic tour de force, a linguistic manipulation. It's a tranquilizer. It will calm the person down, make them easier to have in this building, maybe easier to manage. Possibly of use to the person, but not rationalized because you claim you're treating a disease, because you haven't found any. Now, here's something that I've said over and over again. I want to give you the tools. You wouldn't have the tools to know this next thing I want to talk about because you haven't worked in the mental setting, the mental hospital setting or the mental patient setting. But let me show you what psychiatrists so often do to show they're not treating anything specific. It's very, very common when psychiatrists give a drug. If they don't like the result, if they don't think the person is responding the way they hope they will, what do? They change the diagnosis. Now, in real medicine, you don't change the diagnosis because the treatment is not working. That becomes ridiculous, totally unacceptable. The diagnosis is the diagnosis. If it's a real disease, you have a real diagnosis once you discover the disease. Psychiatrists all the time, they simply change the diagnosis because in psychiatry, diagnosis is not really a treatment, as I've said. It's a strategy. The label that psychiatrists pick, which summarizes behavior and feelings, but not the cause, the diagnosis they pick is the one which will rationalize the use of a particular drug. Maybe the one the psychiatrist happens to like, or read an article about, or somebody says this is the one for this kind of presentation. If they don't get the result they like, they change the diagnosis, because then the books say, well, for that diagnosis, this is the right drug. You don't see that happening in real medicine. If it's pancreatic cancer, it's pancreatic cancer. The diagnosis doesn't change. They might change the treatment, but they don't change the diagnosis because it has a meaning of its own. So psychiatry is not practicing real medicine. It's practicing something which was designed to ensure that psychiatry would continue to be in the leadership role. It's a system which has been created by the National Institutes of Mental Health, by the American Psychiatric Association, by psychiatrists who get trained by departments of psychiatry, all of which now are headed by these biologically oriented psychiatrists who give us the same kind of information that Dr. Andreessen was claiming and is now being claimed by the whole profession. Back in '84, the quotes I gave you last time from Dr. Andreessen were not just her, they were representative of the profession, and it has grown and grown. It's a juggernaut. In the next session, we're going to move on to give you some more examples of how the best and the brightest are continuing to manipulate our people. It's now a worldwide phenomenon by claiming to have treatments which treat diseases that are specific diseases and which are dangerous. Come back, and we'll carry on with that.